When you look at somebody's face, the first thing that people tend to look at is right into somebody's eyes. And for me, as an oculofacial plastic surgeon, I really want to be able to restore somebody's confidence in being able to look back at the other person. The eyelids, in many ways, are the keystone to the entire face. And what I do with eyelid surgery ranges from trying to establish the right brow height, the right upper eyelid height, not having too much extra skin, and having the eyelids just at where they're the right height, that they're able to open beautifully, but also close. And the lower eyelids are where many of the hallmarks of aging can occur, and my goal is to try to make that not noticeable. I grew up in Houston, Texas, and went to Stanford University for college. And after Stanford, I was so lucky to be able to go to the University of Pennsylvania for medical school. And finally, my wife and I made it to Utah. And we lived here during the last portion of my training where I learned to become an oculofacial plastic surgeon. After doing my training in Utah, we moved away for 3 years where I was a faculty member at the University of North Carolina at Chapel Hill, which was a wonderful experience and a great thing for me to be a university professor where I taught other doctors. But ultimately, we really wanted to be back in Utah, and Utah is the only place that I've lived twice, and I don't plan on going anywhere. As an adjunct to many of the things that I do, I love performing non-surgical procedures in the office, such as Botox and filler procedures, both from the standpoint of aesthetics, but also to enhance some of the outcomes with scar modulation and many of the things we can do to improve our outcomes in facial surgery. My goal for all of my patients is at the end of our time together that they can look in the mirror and say, I like the way that I look.